important thing when we're looking at a commercial diet, like the sort of diet that you would buy in the store, whether it's, kibble or canned food or a fresh cooked food, is that in North America, there's an organization that you may be familiar with called AAFCO, which is the Association of American Feed Control Officials. And they put together guidelines for the industry based on, you may have heard another organization called the NRC, the National Research Council, and independent research that goes on. It gets updated annually. And these recommendations are for specific nutrient profiles for the industry. They also have all sorts of other regulatory recommendations about, for example, testing and what sorts of labs to use and what an allowable variance is. So there's a lot of kind of oversight. In the USA, many of the states have adopted the AAFCO recommendations as regulations. And so pet food is regulated there. So if a food is claiming to be complete and balanced, which is just a marketing term, that means that it has either been formulated to meet the nutritional levels established by AAFCO, or it has undergone a feeding trial, or is part of what they call a family of products that has either been formulated to meet these nutritional levels or undergone a feeding trial, which means if it's essentially the exact same product, but with a different flavor, so a different palatant added. So these commercial diets provide everything that a dog is known to need for whichever life stage it says that it is appropriate for. So what I would say is in Canada, which I'm assuming most of our listeners are this evening, we don't have the same kind of regulatory oversight. Really, anybody could make dog food and sell it out of their garage as long as they have a label that has, their name and address and, dog food and the net weight. So it's not a regulated industry. And so we do run into a few more problems up here, especially with people marketing the raw animal products. They're often associated with kind of small slaughterhouses, and they just grab things and sell it. So keep an eye whenever you're purchasing anything to look for something that has this statement on here. So you can see here's an example that I've just pulled off of the AAFCO new recommendations. And so it has to actually have verbatim this sort of statement if it actually is a product that is kind of compliant. Now, most products that are made in Canada, if they're being exported to the States, so most of our really big manufacturers, they all have to meet AAFCO recommendations anyways, because they're crossing the border. So really, if it's a large company and or they're exporting, then that they're going to be meeting these requirements. But some of our kind of smaller locally made products does not mean that they don't meet the nutritional levels. You just need to make sure that they have a statement saying that they do, in order to ensure that that they've done their kind of due diligence in formulating that product.
And when we say nutritional levels, I assume that there's a range, sort of optimum protein would be from X% to X%. Is it just meeting the minimal nutritional needs, or is it just at the optimum level?
So it depends. It varies by nutrient. Most of the nutrients just have a minimum that the diet has to contain more of. And there's two life stages that are recognized. There's growth, and there is adult maintenance. So many of the nutrients are higher in requirement for growth. And so the growth requirements are higher, but most of the nutrients just have a minimum. But there are some nutrients that have a maximum as well, because it is recognized that if we go above this safe upper limit, we actually see adverse health effects. For most of them, it's just a minimum. And that minimum is established with quite a safety margin already built in, because AAFCO assumes that the digestibility and bioavailability of the product is going to be lower than what was used in the research to determine these. A lot of the research uses purified diets, or for example, free amino acids, which are essentially 100% digestible and bioavailable. Whereas a commercial product, you're using ingredients, and typically we want to see, high digestibility levels like protein over 90%, fat over 90%, carbs over 80%. But that's accounting for there being some of that nutrient that's not actually being absorbed. And so the minimums that AFCO set, they already have that kind of safety margin built in. So if you're meeting that minimum, that you're actually quite above the real minimum requirement, if you're meeting that minimum recommendation.
Okay. So if we are sort of at least meeting the minimal recommendation, are there any sort of nutritional elements that you find dogs commonly lack, whether it's because there's a lack of variation in the diet or they just don't absorb it well or for whatever reason?
I would say by and large, not particularly, because we have these recognized essential nutrients, which means that we know that there are adverse health outcomes if we have these either in an inadequate content or in an inadequate ratio to each other. So that's where that concept of kind of complete and balanced comes from. And that is to make sure that not only are we meeting all of those nutrient targets, but we're also doing it in a way that is kind of compatible to each other. So from like an essential health perspective, we don't really need to add anything on top because we should be meeting all of their nutritional needs. However, there are certain circumstances where nutrients that are not essential might be beneficial to have in higher quantities. So for example, taurine is not recognized as an essential amino acid for dogs. It is for cats. However, there are circumstances where it's conditionally essential, which means that individual actually does have a dietary requirement. And so there are circumstances in which we want to be, adding some conditionally essential or even non-essential nutrients to the diet if it's not already contained or fortified in that commercial diet.
Is it possible? I mean, it's definitely beneficial to supplement, but is it possible that people get a little overzealous and overdo it?
We need to be cognizant of what nutrient we are adding, how we're adding that. Is it appropriate for that dog, to make sure that we are not causing any problems? Because, over-supplementation could actually be just as problematic as under provision of a nutrient. So I've listed there all of the essential nutrients that have known safe upper limits. You'll see the third one down next to the calcium to phosphorus ratio. So we can have too much calcium in comparison to phosphorus, even if both of those are below their safe upper limit, or we can have too much phosphorus in relation to calcium. And so issues with those top three are very dramatic, and they happen very quickly. So that's especially if we're looking at like a growing puppy, really, really critical to make sure that those are provided in appropriate quantities and appropriate ratios. Other ones takes certainly like a little bit longer to see any problems, and oftentimes the signs are like non-specific. So, if you have a selenium deficiency, you're not going to see signs like overnight. There's no one thing where it's like, oh, boom, that's definitely a selenium deficiency. Same with selenium toxicity. Unless you have a huge, ridiculous overdose, it's going to take quite a while to notice that there's issues. And again, they're going to be non-specific. And so it's easier to really kind of keep an eye, look at what the dose of the nutrient is that's coming from the food, before adding any sorts of supplements that contain those essential nutrients, especially the ones with the safe upper limits.
And because there's sort of no regulation, I'm assuming there's also no regulation in supplements. And at a pet store, there are as many supplements as there are versions of dog food. Do you find that the dosages that are suggested by the manufacturers are quote unquote correct?
Sometimes. So in Canada, we actually have a little bit more regulation over supplements than they do in the States, which is surprising. So we do have oversight from Health Canada. However, it's very, very poorly enforced, basically. I can't tell you how many, like if I walked into a pet store and looked at like the rows and rows and rows of supplements, how many of those would never have had any interactions with Health Canada? It is an absolute nightmare getting supplements approved through Health Canada. It's a lot of time in my life I'm never going to get back going through their paperwork, but I think it's worth it to know that you have again that kind of oversight, and really it's about ensuring the safety of the products and efficacy as well, so that people are not making claims. If you could buy a supplement off the shelf and it says cures cancer, but if it's not actually doing that, then that's not really appropriate. But you see, there's some weird and wacky claims out there, and a lot of people overpromise and underdeliver. So definitely something to be careful of when looking at supplements, and to make sure. In the States, there's an organization called the National Animal Supplement Council, so NASC. It's not a necessity for companies to either use an NASC facility or to be NASC certified themselves. But as a consumer, it gives you a lot more confidence that there is quality assurance, that there's quality control over that product, that the ingredients that are being used are safe and they're efficacious for the intended use.
Their biggest concern and their biggest motivation to supplement is just to be a little bit precautious about things that happen in a dog's later life, such as things like hip dysplasia, patella issues. Is there any specific food or supplements that can help with that?
Yes and no. So both luxating patellas and hip dysplasia are congenital disorders. So they are genetic. And so that's why we see certain breeds have, a greater risk than others. But just because you have the genetic potential to express something doesn't mean you're necessarily going to, or something that, you have the genetic potential could certainly be exacerbated by environmental factors. And so if we're looking at puppies who are at risk of hip dysplasia, because you can't diagnose hip dysplasia in a puppy, you can't diagnose it until they're skeletally mature. So if there's any concern, then we need to really look at how we're raising those puppies in order to physically and nutritionally support appropriate growth and joint development. So really critical in that puppy life phase is to avoid excessively rapid growth, and certainly avoid obesity or overweight, because unlike an adult dog who we can energy restrict in order to have them lose weight, you cannot energy restrict a growing puppy without running into all sorts of other issues. And so if they get ahead of themselves and they start getting overweight, there's really nothing that we can actually do about that until they're an adult. And being overweight during that developmental period puts a lot of extra strain on those joints that are already developing. Your bones are just shooting up, they're growing super fast, and so you have all those laxities in joints and irregularities in the angles, and extra weight really hinders healthy development. So we need to appropriately exercise them. We can't over exercise them because that can also cause joint damage. So really being kind of careful to appropriately support that life stage. And then during development, there may be kind of conditions that we will look at additional kind of dietary, and a good high protein diet is really important during that growth phase, because again, we want to be supporting that lean tissue mass development. Like I said previously, like the calcium and calcium phosphorus ratio are absolutely critical during this time. And also there are some supplements that can help to support healthy cartilage development. So there's a lot of research that's been done on especially glucosamine and chondroitin. And unfortunately, every study that you read will have a different outcome. And typically that's because every study has different inclusion factors for, what dogs they're looking at. There's so many different forms. You can get glucosamine from a whole bunch of different places in nature. And you can also get it in, liquids, in powders, and all of that impacts how efficacious it is for the animal, and the dose as well. So working with a veterinarian or a veterinary nutritionist to develop like an appropriate, dosing regimen for that developing puppy would be pretty important. If we're looking at adults, which a lot of times, we are in rescue, then that period has passed. And they either already have the luxating patellas or they already have the hip dysplasia, and nothing that we do physically or nutritionally is going to change that. But what we can do is, again, controlling that weight, keeping them a lean, healthy weight. The more muscle mass that they have, the better supported those joints are. So it might seem a little counterintuitive because obviously muscle is heavy, but having more muscle around that joint really helps to support it and actually puts less pressure through the joint because the muscles are taking some of that strain as well. And the other thing is for arthritis, really the number one nutrient that has or two nutrients, I guess, together that have the most evidence for efficacy is EPA and DHA, which are those omega-3 fatty acids from marine sources.
Again, luxating patella and hip dysplasia are probably the most common concerns for adopters. I think because it's physical, they see it. Dogs slow down, they show pain. But another sort of area I think is often overlooked is eyes and heart. Come back and all of a sudden there's a heart issue or glaucoma develops or cataracts and whatnot. Are there any foods that help in those areas or any supplements as well?
So for eyes, unfortunately, it's a very similar story as with our dysplasias, and that development is the most critical time period. And so ensuring that they have adequate vitamin A and the vitamin A precursor carotenoids, which are much safer to supplement than vitamin A is. And the reason for that being that the carotenoids have to undergo metabolism to become vitamin A, and that has a negative feedback looping. So if vitamin A levels get too high, the body will stop converting carotene into vitamin A, and then you don't have a vitamin A excess. But that's really critical during development. EPA and DHA, which I touched on previously as being anti-inflammatory, also is an essential nutrient during development because it helps with the nerves, so brain development as well as visual development. So it's one of those conditionally essential nutrients in that it's essential during growth. It's not considered essential for adults. However, it has a whole host of benefits. But again, if we're looking at an adult animal, then we can throw all the vitamin A and EPA and DHA at them, and it's not actually going to change really a whole lot about the anatomy or physiology of their eye at this point. But there is some evidence, especially that antioxidants can help to preserve and improve vision. So these are dogs who already have some degree of degenerative disease in their eyes, and we actually can help to slow that progression and maintain vision for longer. And it's very, very common. We see as dogs age, even very healthy dogs who had the best start early in life, which again is not always the case in rescue. But we see that they will, inevitably develop some visual losses as well as they age, just like we do. And so providing a diet that's really rich in antioxidants can help. And so all of these antioxidants come from plant sources. So we can support them by feeding fruits and vegetables in their diet, or we can get kind of supplemental antioxidants and kind of purified forms so that we can provide, a higher dose. For heart health, the most common conditions that we see in dogs are genetically acquired, and so not necessarily congenital in that they're not necessarily present at birth, but they have the genetic potential to develop these conditions over time. And again, we see very much these are breed specific. So I would say kind of luxating patellas is usually like a small dog problem, and hip dysplasia is usually a big dog problem. Regurgitating heart valves is usually a small dog problem, whereas dilated cardiomyopathy is often a large dog problem, especially Dobermans. But we actually have a lot more that we can do from a nutritional perspective to intervene here once these have already taken place. So it's harder to be more kind of proactive and preventative here because these conditions actually kind of onset later in aging. So you could have that genetic potential and not know it until it actually starts to express. Some puppies will have a heart murmur from birth, and they'll have some regurgitation from the valves from birth, and you already know what's going on there. But when it starts to happen when they're older, we actually have a lot more that we can do to support. So there are a number of kind of like cardiac diets that are out there of our kind of veterinary therapeutic diets, and predominantly those are all about electrolyte balance. So we want to make sure that we have a lower content of sodium so that we aren't volume overloading and increasing blood pressure. There are other electrolytes like potassium. They're really critical for heart health. And so those therapeutic diets have very, very specific levels of those electrolytes in them. But in addition to that, we can also support heart health by providing, again, those antioxidants, which really help to preserve the cardiomyocytes. We can improve the cardiac blood supply with EPA and DHA. You're going to hear me mention that a lot tonight. You'd think I had stocks in an omega-3 company, but EPA and DHA from marine sources, again, doesn't work if you give them flax. Unlike us, they cannot create those longer chain fatty acids, the EPA and DHA from shorter chain omega-3s. So flax is great for other reasons, but EPA and DHA needs to come from marine sources for dogs. And so it helps to improve blood supply. It's a different dose than we use for arthritis. It's a lower dose than what we use for arthritis, but that's really beneficial. And then supporting the energy metabolism for the heart, because what we can see is that with either inflammatory causes where the antioxidants really help, or when we have kind of degenerative, we see that those cardiomyocytes are actually losing energy. They're not able to metabolize glucose as well as they previously did. And so by providing specific fatty acids, so you see MCT there stands for medium chain triglycerides, which come from coconut or palm oil, or we can get purified MCT oil. And that helps to provide another additional substrate for those myocytes to be able to use. And then we have a few nutrients there that really help with that energy metabolism as well. So creatine and taurine, I think everybody at this point, thanks to the FDA, are familiar with taurine and heart health. And then we can either supplement carnitine, although there's some evidence that supporting carnitine precursors like methionine and lysine is actually healthier than supplying carnitine directly. And the B vitamins, which help for energy metabolism throughout the body, and our CoQ10, which again is throughout the body for energy metabolism. And then more recently, there's been some research that has looked at the association between gut health and heart health, and that some dogs who have even these kind of genetic conditions have an altered microbiome, at least at the time of expression of the disease. And potentially by manipulating that microbiome and looking at, what the levels are of the kind of, unhealthy gut compared to the healthy gut, and, kind of moderating it to look more like the healthy gut, we can actually potentially preserve heart health. So really interesting. I mean, the gut interacts with like everything in the body, but really fascinating, because you wouldn't really think of, probiotics for heart health, but it actually can have an impact.
So obviously nutritional needs are going to vary through different life stages. And there are ready-made foods that are specifically catered to each life stage. But how do we actually know when to make the switch from puppy to adult formula or adult formula to senior formula?
So that is a great question. There are some kind of arbitrary numbers that we throw out there. But the reality is that there's a lot of individual differences. So with our smaller dogs, they mature faster. Oftentimes, if we are desexing, we'll usually, spay or neuter them around, 6 or 8 months of age. And they have pretty closely met their adult size at that time. They will go on to develop more like skeletally after that, but there's a big risk of obesity if we continue feeding them a puppy diet for too long, because the puppy diets are very high in energy because we're supporting that growth. And so they typically are higher in fat, and even the minimum requirements and the minimum recommendations for puppies are higher. And so if we're maintaining them on a puppy diet, then that can become a problem. As well, kind of all life stages diets are actually puppy diets. They just have a different name on them for marketing so that people will buy them for adults as well as puppies. But the reality is that if something says all life stages, that is a puppy diet. And so it is appropriate for growth. But there are risks if we continue to feed that to adults if we're not taking into consideration that they have, different requirements. And so for our small dogs, really commonly we'll recommend switching over to an adult diet shortly after desexing. So usually kind of around 8 months or so. And, the reason for that is, again, they're maturing faster, so they don't have a whole lot of growing left to do. And B, removal of the sexual organs actually reduces their metabolic rate. And so if you have, 2 dogs the exact same size, and they're perfect lean ideal condition and they're fed the same, and then one gets, spayed or neutered, but the other one doesn't, if you maintain them at the same food again, the one that's spayed or neutered is at much greater risk of becoming obese, even though they're being fed the same amount as that other dog who's the exact same kind of size, weight, everything. And so that's generally when we recommend switching over from a puppy diet to an adult diet. Now, for larger dogs, we keep them on like a puppy diet for far longer. But we have to be really careful with our large dogs to make sure that they are growing at an appropriate rate and we're not seeing excessively fast growth. And there's actually a couple of resources. Thinking about it, I really wish I'd put it on this slide, but there's a research organization called the Waltham Group. That's WALTHAM. And they're based in the UK, and they have put out a number of growth charts based on decades of research that they've done with all sorts of different breeds and sizes of dogs. And they've developed these growth curves so that regardless of, where your dog starts, there's all these kind of quantiles on it. And you don't have to fit a specific growth curve line, but you want them to fit that trend. And so if you're tracking growth and you see all of a sudden, things are kind of going up too fast, then maybe you want to pull it back a little, or you're plateauing a little bit, you want to give a little more energy, because we want to maintain that really smooth, nice growth curve so that we don't have any issues, and particularly with large dogs, skeletal abnormalities that we see, and that predisposes them to, arthritis at a younger age. They're already at greater risk for arthritis, but so in terms of maturity and when we need to switch from a puppy diet to an adult diet, oftentimes we'll consider it kind of between 2 to some dogs 3 years old. And that is for them to really attain that skeletal maturity before we move them onto a diet that might be a little bit lower in calcium or phosphorus. The requirements for products that are labeled for large dog puppy growth, you'll see the AFCO statement specifies whether or not it is appropriate, and they consider a large dog to be any dog with a mature weight over 70 pounds. So not even, just our giant dogs, but they have a tighter range for that calcium to phosphorus ratio and the total amount of calcium and phosphorus that is allowed to make sure that we're actually supporting that growth properly. There used to be a recommendation. I still see it from breeders. I hope there's no vets out there that are still recommending it, but it used to be the in thing to recommend that large breed puppies be fed an adult diet. And the reason is to avoid that excessive growth, because the adult diet is lower in fat, lower in energy typically than a puppy diet. But the adult maintenance diets don't have the same, or they could, but they aren't formulated to have the same amount of calcium and phosphorus. And so they're really not appropriate to be fed to large dogs until they reach that maturity. So again, like, could be kind of a year and a half for some of our, you know, like 20 to 30 to 40 kilo dogs. And over that, you could be looking more kind of 2+ years. It pretty much goes along with the same recommendations. We usually advise delaying desexing surgery for those large dogs as well until they are more skeletally mature. So oftentimes that might not be until they're over a year or close to 2 years of age, especially for the males. Females, it's a little complicated because you have, you know, their cycle starting and their reproductive activity. And if they get spayed after they have a heat cycle, their risk of mammary cancer really goes up. If it's only one heat cycle and then they get spayed, it's not as bad as if they have more. But I think by the time they've had 3 heat cycles, even spaying at that point is not preventative. They are just at very high risk of mammary cancer. So sorry, that kind of got into surgery instead of just nutrition, but it's, you know, we generally recommend the switch from the puppy to the adult happens, you know, around the same time as that desexing surgery, because both are, you know, kind of trying to be timed for when they reach that mature stage.
Mm-hmm.
And that kind of brings us to what the requirements are for adult maintenance. And those requirements are far lower than for puppy growth. Because you think, you know, think of like how much a teenager eats, if anybody here has kids, or recently was a kid themselves. You know, they are growing and they are eating so much. But when you have that in a puppy who matures in like 1 to 2 years instead of 20, you can imagine that energy that's required to grow and mature that body so fast. And so their energy requirements are very, very high compared to adult requirements. So we really need to make sure that when we're feeding an adult dog, that we're not overfeeding energy, because obesity is probably the greatest kind of health condition that we see in veterinary medicine, other than maybe dental disease, I guess, is maybe just as prevalent. But overweight and obesity, obesity is a disease recognized in dogs in and of itself. It is not just a predisposing factor to disease. And so avoiding that is really critical. And so by feeding a diet that's appropriate for adult maintenance, so it's lower in energy, generally lower in fat, we reduce the risk of obesity. And then for adults, we have kind of size specific support. So if we're looking at larger dogs, then you'll often see that there's added, you know, joint supplements like glucosamine, chondroitin might be built into the diet. A lot of times you'll see that EPA and DHA, or the omega-3 fatty acids, will be there. Or if we have smaller dogs, then sometimes those diets will be geared more towards like dental health, because those smaller teeth, they kind of have all the ridges and grooves all closer together, and so they're more at risk of kind of trapping food material and bacteria and developing dental disease, even if you're brushing regularly, compared to a larger tooth. So that's that kind of size specific support that we can really kind of tailor our recommendations for adult maintenance to. There's also kind of like type specific support. So, you know, like your long haired dogs versus your short haired dogs, and, you know, things like that we can really kind of tailor to the individual and activity level. So most pets Even though people think that they're, very active, going for, 30-minute walks every day or something, those pets, their activity level is considered sedentary. So they really don't have any higher energy requirements, even for like the most active pet, generally speaking, unless we have a dog who's engaged in a lot of dog sport. So like agility or dock diving. But even those, unless they are participating really regularly and for a long period of time, it actually doesn't even increase their activity level that much. I mean, you think about dock diving, they just kind of run and jump off a dock a few times. It's not that energy intense. But our working dogs definitely have very, very high requirements because they're active for a lot longer. Or, that might be dogs who, live on a rural property and are out like all day, and also maybe exposed to the elements a little bit more. And so they actually need a little bit more energy to maintain thermoneutrality. But all over kind of like adult maintenance, generally, the biggest goal is just to avoid overfeeding and make sure that we're meeting those requirements. And then we move on to senior. And unlike puppy growth and adult maintenance, where we have nutrient profiles that are defined and it can say, meets the AFCO growth nutrient profile, meets the AFCO maintenance nutrient profile, there's no such thing as a senior nutrient profile. We don't have scientifically recognized senior diets. And probably one of the reasons for that is that seniors and aging animals are very individual in their requirements, and so we can see very, very different approaches to what senior support looks like. I've put a couple of examples on this slide. Some companies will call a senior diet a diet that's like low in protein to reduce the strain on the liver and kidneys. Others will say that a senior diet is high protein because we're supporting, heart health and maintaining that muscle mass for longer. They might be low fat because geriatrics tend not to even be as active as your kind of younger adults. They might be high fat to maintain weight for animals who, might have less of an appetite or be eating less. And so there's so many different directions you can go with a senior diet, and really looking at each dog as an individual and what their specific requirements are will help you to pick which kind of senior type food is best for them. And they don't even necessarily need like a senior type food. An adult maintenance diet might just be fine. There are kind of 3 conditions that I would say are relevant across the board. And that would be cognitive support, immune support, and digestibility. So we recognize that older dogs have not as healthy guts, I guess is a way to say it. So they're not as functional. They have a reduced digestibility of the same sorts of nutrients compared to younger adults. And so we want to make sure that the diet has an adequate degree of digestibility, that they're actually able to get all of those nutrients, because just putting the nutrients in the food doesn't actually mean they're getting to where they need to be in the dog. And so digestibility is an important factor. Immune support, because, as we age, we certainly run into all sorts of different conditions, and maintaining the immune system there can really help to keep that dog, healthy for longer. And cognitive support, I think, is really important. I don't think we do a very good job at recognizing canine cognitive dysfunction. That's essentially our kind of like doggy dementia name. And there are more kind of tools out there, and there's a lot more recognition in the veterinary community about what cognitive dysfunction looks like. But I think we don't do a very good job of educating pet parents about what that cognitive decline looks like. And it's really important to support the seniors in maintaining their cognitive function for as long as they can. And so we can do that MCT oil the same way that can be beneficial for the heart in terms of providing that auxiliary source of energy. Also really helpful for the brain from the same reason. We see as dogs age that some of their brain cells are not as good at actually burning glucose. And so you can see regions of the brain that have low energy, essentially. But if we provide MCT oil then they can actually use that substrate. So those cells that otherwise weren't doing so well, we can actually support them better. And so we have that cellular metabolism going, and those cells stay healthy and active longer. And antioxidants, because every time you have cellular respiration, you have free radical formation. And so antioxidants are really critical for cognitive support and support of basically every single health system in the body.
Okay. I just want to sort of go back to your comment on how everyone knows about the sort of, not everyone knows about it. I feel like everyone has heard about the whole taurine and heart health correlation. And it's probably a very common topic within our adopters network as well, because some adopters say, oh, I was told to feed grain-free, and others were like, oh, I was not. And there is this whole sort of correlation between, is it grains that cause this heart condition called DCM, or is it a lack of grains that supposedly causes DCM? But there is a whole thing about grains and heart health, if we can get into that.
I'll try to be nice here. We in the industry, we're a little miffed at the FDA about this because the reporting was terrible. So I think it was 2018, maybe 2019, but I think 2018, that the FDA released this statement about grain-free diets and DCM in dogs. It was very poorly studied prior to that. It was actually just kind of an incomplete case series that they based this on. And at that point, grain-free was a huge trend in the pet food industry, really due to some clever marketing from a few big companies that changed the course of the industry entirely. But, you know, regardless of whether it's right or wrong, the grain-free thing was huge. And so we had, you know, millions and millions of dogs eating grain-free diets, and a small handful of dogs who were not the usual breeds that were predisposed to DCM. And we were seeing, so we'd kind of call it, you can call it like an atypical DCM. And a large proportion of those dogs happened to be fed grain-free diets, because a large proportion of dogs at that time in general were fed grain-free diets. But there was this kind of association, and so the entire industry really kind of turned on its head overnight about the whole, you know, grain situation. And the reality is there's no nutritional requirement for grains. So it's not that a lack of grains can cause DCM. The other thing that got tossed around was that it wasn't because necessarily the diets were grain-free per se. It was because other ingredients had to be added to make up for the lack of grains, because we need carbohydrates. We need soluble carbohydrates to make kibble. That is how the extrusion process works. You have essentially a dough that goes through the extruder, which is the equipment used to make it. It's kind of like a pressure cooker. And it comes out, and when it hits air, the starch, which is a carbohydrate, gelatinizes and it expands. And when it hits air, it solidifies. And so that's why you have this kind of puffed kibble versus like a pellet. And so if you take grains out of the diet, you need to add some other source of carbohydrate. And so a lot of these grain-free diets were then turning to high inclusion of legumes. And so the industry was kind of like, okay, like, is it grain-free? Is it high legume? There was some work that got put out, you know, talking about like boutique diets, or boutique and exotic and grain-free diets, or diets that have peas or potatoes in a certain order on the ingredient list. But the reality is that there's no definitive answer as to why we had some dogs that developed this issue. We didn't see the same issue in Europe. We didn't see the same issue in Asia or Australasia. it seemed to be very predominant to North America. And so there's a lot of criticism about whether, was this even truly an increase in cases of DCM, or were more cases being referred to cardiologists and being recognized because people are being more proactive. We had a lot more expendable income in 2019 than most of us do now. Thank you, recession. And so, people were more proactive about healthcare for their pets. And, maybe a murmur that wouldn't have been worked up before was now being referred to a cardiologist. And so there's all sorts of reasons why we may have seen an uptick. If there is a true association between, grain-free diets and DCM, the most likely causes would be an imbalance of essential amino acids. So even though these diets met the essential amino acid requirements, because they were AAFCO labeled diets by and large, those amino acids may not have been in an appropriate balance to each other, which can cause essentially a relative deficiency. And one of the concerns there was taurine. So taurine is essential for cardiac function. We learned that in, I think it was maybe 1996. There was a landmark paper published by a very famous veterinary cardiologist, where they demonstrated that cats fed canned food were developing heart disease, DCM, and it was because the taurine was being denatured during the cooking process, because it's actually not a very stable nutrient when it's coming from the ingredients that are being processed. And they found that by adding synthetic taurine to the diet, they could not only prevent, but even reverse some of the DCM they were seeing in cats. And so from that point on, loads of research went on, and we understood a lot more about the essentiality of taurine for cats, and this potential relative deficiency that we can see in dogs. And so it can be caused by a low intake of sulfur amino acids. And so that's one of the factors that we think might be going on, especially with very large dogs who have lower energy requirements, because we see energy requirements are not linear with dog size. And so they do taper, because it's an exponential equation that we do to estimate energy that best describes energy requirements. And so if we're feeding large dogs, really large dogs with low energy requirements, so typically like Newfoundland dogs, then we might actually not be meeting their amino acid requirements if we're meeting their energy requirements, because their energy requirements are lower. So we may actually have a relative deficiency. And those sulfur amino acids are the precursors for taurine. And so that could be a thing. But we also did see that some of the dogs that were reported by the FDA, they didn't have low taurine, or they had low taurine that didn't respond to taurine supplementation, or they didn't receive taurine supplementation, but they changed diets and they improved. Some of them even changed to a different grain-free diet and improved. So we don't have any great answers. Really, it could be associated, particularly with those sulfur amino acids. Could be that high fiber, because legumes are typically higher in fiber than most of our grains, could be causing an increased, well, either decreased absorption of methionine, cysteine, taurine, or could be causing increased excretion of taurine, because taurine is used to conjugate bile acids. And so if it gets trapped with fiber, then you excrete more. And maybe that's where that relative deficiency came in. But certainly, just like we don't have any nutritional requirement for grains, we don't have any real requirements for grain-free either. So there's no kind of real need for anyone to really panic over this anymore. And I saw this interesting phenomenon where a lot of veterinarians were recommending that people feeding grain-free diets add a grain. So they'd be feeding like a store-bought grain-free diet, and then they'd be adding like rice on top or something. And that's not going to do the trick. There's no essential nutrient from any particular grain that you're going to add to the diet that way. In fact, you'd actually just be diluting essential nutrients more. So that's not necessary by any stretch. But yeah, all of that is to say that the incidence of DCM in dogs, regardless of whether they're fed grain-free or not, has not greatly increased. We have a lot of breed predispositions. DCM is I think the second most common condition in dogs. But we do not recognize that there is a strong correlation between grain-free and DCM.
So moving on to sort of the next, we've mentioned a lot of foods, and obviously it takes a lot of different foods to make up the nutritional requirements of a balanced diet. But then we have dogs that you buy them the most expensive kibble or meal or whatever it is, and they're like, oh, I'm allergic. I'm itchy. My paws are raw. It's just not working. Are there any sort of repeat offenders, you would say, so that people can avoid those at the top of the list and sort of conduct a process of elimination?
Yeah, so like I had on the previous slide, grains are not the culprit typically here. A lot of times people, as soon as they have kind of itching, scratching with their dog, they're like, oh, I need a grain-free diet. And grains are really usually not the bad guy here. In fact, dietary allergies in some are not usually actually the problem. A lot of people, as soon as their dog gets an ear infection or has some paw licking or itching, scratching, think that it's dietary allergy, but it's actually less common than environmental allergies. So we have a small proportion of dogs who have skin conditions that are actually allergic to what's in their food, and an even smaller number of dogs who have GI signs that are actually allergic to something in their food. So we can have non-allergic adverse food reaction, but true food allergies, we actually don't recognize true food allergies very commonly. When we do, it's usually to a protein source. It requires previous exposure for it to actually have an allergic reaction, because your body needs to recognize that antigen and have antibodies against that antigen in order to have an allergic reaction. And so they have to have already been exposed to that protein in order to develop an allergy to it. And that doesn't mean they had seen it once and then they were fed something else and then they can develop an allergy. They can be fed one thing consistently and then develop an allergy to it. But usually we see that around a year of age. So it's typically as they're kind of coming towards maturity that we start to see signs. It's very uncommon to see signs in puppies because, again, they require that previous exposure. It's very uncommon to see true dietary allergies have an onset later in life, because if it's truly an immune-mediated reaction, we would have seen it usually occur earlier in life. There's no reason for that to sit latent and then suddenly become a problem later. Typically, if it's a problem, it's a problem. And then we see that around that time of maturity. Typically, the proteins that we see allergies to are the most common proteins in pet foods, which makes sense. And so those animal proteins are far and above the most common allergens. We see a smaller subset who have allergies to high protein plant-based ingredients, but not very many. And then a few to the less common animal proteins that we see in canine diets. But by far and away, the chicken, beef, and dairy are the number 1, 2, and 3 causes. And so by eliminating those from the diet, we can rule out a lot of problems.
Okay. And is there any sort of repeat offenders in terms of allergies. Oh no, sorry, not allergies. Upset stomachs.
Okay.
And sort of like, I guess, consistent loose stools and going more often than they should during a day.
Yes. So there can be a few different conditions going on there. And if it is just an occasional kind of upset stomach, that could look maybe like you said, loose stool once in a while, kind of sporadic. Could be vomiting, could be overt diarrhea. Then we have kind of approaches to dealing with that. You'll often hear like a bland diet is recommended. And what a bland diet means is that it is highly digestible because that reduces the amount of nutrients that are coming into the hindgut, reduces the osmotic pressure there to pull moisture into the gut to actually be that loose stool and diarrhea, the watery stuff coming out. And the animal is absorbing more and acquiring more nutrition from it. Minimal ingredients is important because if this dog is having some sort of inflammatory reaction, the more ingredients that are present in their food, the more things we need to, like the more kind of factors that need to be considered in terms of, what could be associated with this disruption. Usually it's not anything in their standard diet. It's usually they've been, exposed to something. And, just like we have tummy bugs that just unexplainably come around once in a while and we don't really like test for it. It's the same in dogs. There are loads of different viruses out there in the environment that are just transitory. They have a little bit of an upset and then it self-resolves. But we still want to keep the ingredients very simple so that it's easy on the dog and it's easy for us to determine what's going on. And the other important factor is low fat, because if we're having any sort of issues with absorption of nutrients, which typically we are if we're seeing diarrhea or vomiting, fat content reduces that digestibility sometimes. We can see that fat comes passing through, causes more problems. And if we have vomiting, a higher fat diet keeps food in the stomach for longer. And so they're more likely to vomit that back up than something that is, moving out faster. We can add in GI supplements to support dogs.
Sorry, I just wanted to take a step back and ask, so what exactly does a bland diet quantify as? Is that the pumpkin diet or the common boiled chicken and rice diet?
Good question. Yeah, so I'm a big fan of either like pumpkin and sweet potato and tofu, or another like bland, highly digestible protein. Usually single source. And by no means is that a balanced diet, just feeding like one protein and one carb. But like I said, that keeps things simple. It's easy for the animal to digest. We are supporting, by including like the pumpkin or the sweet potato, we are supporting their gut a little bit, even though those ingredients are not as digestible. They act as a prebiotic. So that fiber is there to support the gut health. It supports the microbiome, and we have, production of those nice volatile fatty acids, nourishes the gut. So that's really the function of prebiotics. And prebiotics is really just a way of saying soluble fiber, and it supports the gut flora. Probiotics you can add in, but yeah, so I like just a single carb, single protein. If sweet potato or pumpkin is, for some dogs that might be a little too high in fiber, so you could do something like rice or pasta, although usually you want to avoid something that has added ingredients as well. Some pastas have they're enriched and have additives, or even just plain potatoes as opposed to sweet potatoes, because plain potatoes are a little bit higher in starch, which is a highly digestible carbohydrate, a little bit lower in fiber. And so doing that kind of single protein, single carb, you can get away with that for quite a number of days. However, I would say, if the diarrhea is not resolved, or not just diarrhea, but the GI disruption of whatever description is not resolving in kind of 3 to 5 days, then you would want to go to the veterinarian to see, what could be going on. Even though it's safe to feed that diet for, an extended period of time, you can feed an adult dog an imbalanced diet for a number of months before you actually see any adverse health outcomes. Keeping this bland diet at like 75% and then giving like 25% of their old diet, leave that for a few days, and then kind of do 50-50 and then 25-75. And some dogs require a slower transition. Some dogs are fine, transitioning over, a week, 2 weeks. But just kind of doing that gradually helps, our most sensitives. Most dogs, because it's a self-resolving issue, you could just change their diet overnight. It would be no problem, but we always make our recommendations tailored to the most sensitive ones who need that extra time for their gut to adjust. So with that bland diet, we can also support with supplements to help, again, nourish the gut. I touched on the prebiotics and probiotics. We can also use anti-inflammatories, so plant-based polyphenols, again, EPA and DHA, my favorite. It's got that anti-inflammatory effect. And then feeding management. If we are expecting a dog who has some sort of GI disruption to eat, just one big meal a day or even two kind of medium-sized meals, that is more likely to cause challenges for their gut and slow gut healing. Whereas if we feed much smaller meals spaced out through the day as much as is possible, that can help because it reduces the strain on their gut at any given time. And it allows passage of that material, especially if we have issues with vomiting. That smaller meal comes into the stomach, exits the stomach, and makes its way through before it gets a chance to be vomited up. Also, you don't have the same kind of stretch on the stomach that you do with a large meal. If anybody here is like me and eat really fast so that they can eat more because they love food, not because they're hungry, then you get that stomach stretch. You know exactly what I'm talking about.
Yeah.
And, obviously, if the dog is having any sort of GI discomfort, that's really not helpful. And so keeping those meals smaller and spaced out better throughout not better, but spaced out more throughout the day as much as possible can also help to kind of support the gut and go easy through that period of transitory disruption.
A very small percentage of our dogs do have IBD, but it's probably the largest and most frustrating thing to deal with. Any insights on that?
Yeah, and honestly, that's probably the condition I see the most in terms of, when pet parents come to me for nutritional support or homemade diet formulation, is because their dog has a chronic enteropathy and they have tried everything under the sun with their, veterinarian before they get referred to a nutritionist. And IBD is only one of a number of conditions that fall under the umbrella term chronic enteropathy. And chronic enteropathy, chronic means it's been going on more than a couple of weeks. Enteropathy means that it is an issue affecting the gut. And so we can have a food responsive chronic enteropathy. We could have antibiotic responsive. So sometimes you get recommended to put your dog on metronidazole or tylosin and they get better. That's an antibiotic responsive. We have immunosuppressant responsive, also known as steroid responsive. So you might get told to put your dog on prednisone or even cyclosporin. That's an immunosuppressant responsive. That is the only one that's actually IBD in terms of it's an inflammatory bowel disease. And that's why it responds to that either anti-inflammatory doses or even the autoimmune doses. And the fourth is a very uncommon condition, which is a non-responsive chronic enteropathy, which fails to improve regardless of what we do. And that tends to actually be fatal. And it's recognized that is probably more likely associated, for example, with like a GI lymphoma, as opposed to a chronic enteropathy, because some of these conditions, when you biopsy the gut, can be really hard to tell the difference between inflammatory cellular infiltration versus accumulation due to neoplasia. But that's neither here nor there. What's important is how we deal with these things. And so the two that kind of get lumped together a lot is that food responsive chronic enteropathy and the inflammatory bowel disease, the IBD. And how we approach them is pretty similar from some stances in terms of we're trying to provide something into the gut that is not going to incite inflammation. So if it's food responsive, that means typically that if we change the diet, we see a resolution of clinical signs. So that could be changing the dog to a protein source that they have not been exposed to in the past. Because again, that protein is usually what the body is developing the antibodies against. Or we can use a hydrolyzed protein. That's typically if you're doing a commercial diet. You can do a homemade hydrolyzed diet, but it's not easy. But that's, we tend to switch from one diet to another and the condition resolves and hopefully never rears its ugly head again. Or we have some dogs who do better on a diet that is less processed. And that is not to say that, every single dog under the sun must be on a, fresh cooked or homemade diet by any stretch. But there are some dogs who seem to respond better to a less processed source. So you could have a diet that's based on any given protein. And if you put it through the extruder, the dog responds poorly to the kibble. If you can it, the dog responds poorly. But if you take that exact same protein source, all the same ingredients, in fact, and you make it at home, then the dog does great. And so it's likely that they're actually reacting to compounds that occur during that processing, particularly formations usually between proteins and carbohydrates. And so when we cook them separately at home or in some of those like fresh type foods, the dog actually can do just fine. And so that's our food responsive chronic enteropathy. And it's a little bit easier to manage than true IBD. True IBD can be really challenging because they're not necessarily food responsive. And so changing the diet is not necessarily going to resolve the condition. It might improve the condition, especially if we're using medical management as well. But we're not necessarily going to come to a complete resolution or remission unless we also have an anti-inflammatory, like a steroid on board. So in those cases, sometimes the dog will do well with, one of the like GI type diets. So really highly digestible, low residue. There's less strain on the gut. Usually they have added antioxidants and polyphenols that, are helpful for the gut. And so sometimes that in conjunction with medication is adequate. Sometimes we need to go down that novel or hydrolyzed protein route because during these bouts of inflammation, we recognize that the gut is essentially leaky. And you may have heard of that term, kind of leaky gut syndrome, before. And during this period, the body that wouldn't otherwise have had any sort of hypersensitivity to whatever it's being fed, because that gut is leaky, then we can see parts of proteins passing through that usually would not be absorbed intact. They'd be digested further and absorbed as, dipeptides or free amino acids. But we're seeing these kind of polypeptides that are crossing the blood-gut barrier and being presented to the immune cells. And so we're seeing immune responses being built up against something that is not offensive. And so we typically need to go down the hydrolyzed protein route there so that the protein, hydrolyzation just basically means like pre-digested. So we have smaller polypeptides that are not being recognized as antigens by the body. Or we need to do a novel protein, something that the dog's body has not been sensitized to before, so that during that phase of that kind of leaky gut, when you have the inflammatory flare-ups, the body's not having an immune reaction on top of the inflammatory condition that's already going on. Again, the commercial versus homemade thing sometimes plays a factor here. Sometimes dogs with true IBD, again, for the same reason as our food responsive chronic enteropathies, they might do better on a less processed diet. Certainly not every case. It's not like you can just take these dogs and put them on homemade and magically everything gets better. But in some cases that can be beneficial. And I should also clarify, when I say homemade, I just mean like a kind of fresh cooked type diet. You can either make it at home or somebody else can make it in a commercial kitchen and send to you. It's kind of neither here nor there. And then lastly, because that's an inflammatory condition, anti-inflammatory support is really important. So those anti-inflammatory nutrients, EPA and DHA are marine omega-3s. And, you know, some of those polyphenols, for example, turmeric has really potent anti-inflammatory activity in the gut. On its own, turmeric has terrible bioavailability. A lot of it stays in the gut. Not much actually gets absorbed unless it's in a form that is more highly absorbable, and usually compounded with piperine from black pepper, which increases absorption. But the good thing about turmeric not being absorbed particularly well is that a lot of it stays in the gut. And so it has a lot of local anti-inflammatory activity for the cells lining the gut. And it can be metabolized by the gut microbiome, and then you have all these beneficial postbiotics as well. So, so nutritional anti-inflammatory support really plays a role in those IBD cases as well. I wish that I could kind of give you like a silver bullet to recommend for these cases, but it's very much an individual. Every dog is an individual, and we have to go through their whole kind of diet history and figure out what they've been exposed to, you know, what could have triggered this coming on. Because a lot of times these dogs may have been doing fine for a long period of time in their life, and then all of a sudden this becomes an issue. And stress is generally recognized as one of the big triggers. So I know, Sarah, you and I were kind of commiserating about how you have these dogs from, you know, unknown histories in the past who have eaten whatever they needed to survive.
Yeah.
And they seem to be doing just fine for, you know, as well as they can be. You know, maybe like your pot cakes that are coming up from the Caribbean, or you know, dogs coming from like the dog meat trade. They're not being fed, you know, really wonderful high quality diets. And then maybe it is the stress of the environment change, because I have no other explanation for how you can have these dogs and then they come and then, you know, we feed them these great diets and then all of a sudden they have a problem. So we recognize certainly that that stress can play a really, you know, big role in this. And I don't just mean stress in terms of like psychological stress, although that certainly is a component, but physiological stress as well. So, you know, environmental changes, and that can even be changing from, you know, a shelter to a foster family, or a foster family to an adoptive family. It can be addition of new family members. So another dog, a cat, a child, even just bringing like a partner or a spouse into the home, moving homes, renovations. So we can see all sorts of factors that can kind of bring these conditions on. But there are so many cases where we also just honestly cannot determine any given kind of trigger that caused it. But it is certainly a challenging condition to deal with. But, you know, as you can see, we have a few kind of tools in our pocket to be able to kind of work through them. And at the end of the day, you know, most dogs out there, by and large, we get them to a condition that is manageable. They might never have, you know, perfect fecal score poops every day, but they are happy, they're healthy, and they're maintaining weight, and, you know, they don't have, you know, fulminant diarrhea. They're not going out 5 times overnight every night. And for some, like, you know, just getting them to, you know, a happy, healthy, stable place is the best that we can do, but it's certainly better than nothing. So even though it's a frustrating condition to manage, it typically is manageable one way or another.